Today I'd like to showcase a couple of demos from our more strategic health initiatives at Esri Canada, both of which are really all about helping solve one of Canada's most pressing issues, and that is the primary care crisis, right? What we can see here, this is a common issue that we're seeing up here in Walkerton, Ontario. We can see that over 6.5 million Canadians, that's 1 in 5 people, do not have a family doctor or have access to a family care team, okay? So we can see that this is a similar scene, and in order for us to help connect people to accessible care, we first need to locate where those gaps exist, okay? So that takes us to our first demo. This is the ACES Geospatial Explorer. Now ACES stands for the Acute Care Enhanced Surveillance System. This helps monitor emergency visits across Ontario in near real time. Now the ACES team is based out of Southeast Public Health, so we collaborated with them in Kingston to help glean new geospatial insights on the gaps in primary care access across Ontario using this ACES data. Okay, so this is our Geospatial Explorer. This is actually built using the Esri calcite system, so it's a custom application, which is great. And one of the first things we wanted to do was map out what we call the unattachment rate. That's the proportion of people who don't have a family doctor. So in this map, what you can see is a core pleth map. The darker the green polygons, the more we're seeing a rising rate in unattachment across Ontario. And these blue dots represent hospitals in these locations as well. So I can zoom right into these areas that we might think are concerning, right? I'm gonna look up here near Sault Ste. Marie. I can click on this FSA, and we can instantly identify we're seeing a change from 11% to over 18% in unattachment, right? This is an alarming rate. And of course, this might be influenced by COVID-19. This is between 2020 and 2022. But we can use this map to help pinpoint and prioritize other areas across Ontario. We're seeing this rising problem, right? Okay, next we wanted to bring in the ACES health trends data. So we got a cut of data from Southeast Public Health of anonymized ACES data from the fall of 2022. This amounts to around 500,000 records, right? But that's okay. Within this application, we can readily query and identify data for over 80 different conditions. You can see that here in this drop-down menu. Today, I'm just gonna look at respiratory cases. I can click Map It, and we pretty much instantly and on the fly get a new core pleth map, in this case, sort of a hotspot activity of respiratory cases in darker purple here. So I can click on this polygon, and we can dive more deeply into the activity that's happening in this area. So this is great. We wanted to take it one step further, right? And so look at the ER visits within this area and see how people are traveling to this ER for respiratory cases. So I'm going to click on this Markdale Hospital in this location. I can click where are patients coming from, and we instantly get this spider diagram. This is sort of demonstrating or visualizing really the geographic reach of ER visits for respiratory cases in this hospital. Now this is sort of a stark image, right? Because it showcases that people are traveling in from distances way outside of the hospital's catchment area. In fact, I can even filter down this spider diagram by the severity of these cases. CTAS 1 score, this is really going to be life-threatening conditions like respiratory failure or cardiac arrest. We want these people in the ER, right? But CTAS 4 or CTAS 5, this is like low urgency conditions, like a sore throat, maybe a nagging cough, and we generally don't want people relying on the ER for care. And this is sort of demonstrating a big problem across Ontario, right? When people don't have a family doctor, in a lot of cases, they don't have a choice but to go to the ER for these minor conditions. And this contributes to another big part of this primary care crisis, which is emergency department burden, right? So generally speaking, this application helps uncover some new geographic insights, in some cases local insights, and again, in some of the drivers of the primary care crisis in Ontario. Right, where people seek care, why they seek care, and how we can improve access to care closer to home. In fact, this last point is top priority for Dr. Jane Philpott, who is the chair of Ontario's brand new primary care action team. And one of the ways she wants to resolve the primary care crisis is this concept of a health home. This is where you'd be assigned a family care team simply based on where you live. This is kind of like sending your kids to a school within your school district, right? Super intuitive, inherently spatial. So we collaborated with Dr. Philpott's team, that's the Frontenac, Lennox, and Addington, Ontario health team, to help model these health homes using GIS. So I'm going to show you how we did that here in Kingston. So here's our base map in Kingston. This is using the Community Map of Canada. Thank you to our contributors out there. And the first thing we wanted to do was bring in the locations of the participating clinics in this health home programs. These are the clinics that would sort of house the family care teams as part of the health home. So we've symbolized that here in red. You can click on any clinic and get that affiliate additional information for these participating clinics. But we also have information on the expanded clinic capacity. So basically the new number of patients that any clinic can take on with a new doctor or new healthcare professionals, right? So that's symbolized here in this red proportionate symbology. Okay, next, just like the ACEs work, we wanted to bring in a measure of unattachment rate. But this time we needed to do it right down to the neighborhood level. So luckily, we could work with our partner Environics Analytics community health data set. This is modeled right down to the DA level, and so we've mapped this here as a hexagon map. The darker the hexagons, the more people who are sort of seeking family care want a family doctor on that roster list. Okay, so we've got the locations of our clinics. We have this unattachment rate mapped out. Next comes the fun stuff. So we wanted to model the health homes using, in this case, location allocation analytics. We did this in ArcGIS Pro to ultimately assign these clinics to really the neighborhoods in greatest need. And in this case, we also added some additional parameters, a 30-minute travel distance maximum. This is part of Jane Philpott's criteria for accessible healthcare, as well as that maximum clinic capacity I spoke about a moment ago. And so you can see, once again, in these spider diagrams, that there's a sort of maximum coverage that can be mapped out here based on that optimized allocation. So we worked with the FLA team to help refine these boundaries to be a bit more intuitive for the planners, and ultimately came up with these 6 discrete and optimized health homes across the Kingston area. Now, the great news about this is that the FLA team is already plugging this into action. They're already assigning patients who are over here in this purple health home, the East End Health Home, based on their roster list. So we're so thrilled to see this already be plugged in and make a big difference. But the exciting part about this work is we realized that we have the potential to reduce down this attachment rate across Kingston by 33%. So we've tried to map this out using a reference size map, using ArcGIS Map Viewer in this case. Here, the darker purple dots is representing areas where we could potentially connect that unattached population to care, whereas the blue areas would be sort of remaining in need of care across these zones. But this is still important, right? We can now have planners target within these blue zones where future health homes, where future participating clinics, even allied health services like pharmacies can help fill those gaps in the meantime. Now, pharmacies are really important because here in Ontario, we can recently actually treat up to 13 minor ailments. This is like those CTAS 4 and 5 scores I was speaking about a moment ago. And so we actually integrated the locations of pharmacies. We just brought it right in from ArcGIS, from Esri Canada's Living Atlas, to identify the locations of pharmacies that could be of the greatest need, again, in these blue zones, as they wait to be connected to care. So just taking a step back here, the ACEs demo that I showed you, the health home modeling work here, these both demonstrate how GIS can really help connect people to accessible, to equitable, and in this case, to local primary care. Thank you.